Welcome back to the Pelvic Health Summit. I'm your host, Hannah Matlock, and today we are here with Dr. Iris Kerin Orbuch, a gynecologist who specializes in pelvic pain and endometriosis. She is the director of the Advanced Gynecologic Laparoscopy Center in New York City and Los Angeles. Thank you for being here today.
Hi, thanks for having me back.
So, can you first tell us a little bit about your practice and how you got started in this career in this specialty?
Sure. So my practice is pretty much devoted to helping women with pelvic pain and with a focus on endometriosis. I was fortunate enough to do a fellowship in minimally invasive surgery, and the two mentors of mine who trained me, I look at them like fathers. They were probably one of the first two excisionists, which is a particular type of surgery that they perfected and that they passed on to me, excision surgery for endometriosis. And I personally just fell in love with being in the operating room. I played a lot of video games as a kid. I played a lot of sports, so a lot of hand-eye coordination. So I really honestly felt at home in the operating room, and helping young women achieve their potential and reclaiming their lives and live their lives to their fullest is something that just really speaks to me. So marrying all of those aspects, this was like the perfect just career path for me.
And what does advanced endometriosis treatment mean for you?
So it's such an interesting question because what it means to me today is very different than what it meant for me coming out of my fellowship about 15, 16 years ago. So when I came out of my fellowship initially, it meant advanced excision surgery, meaning minimally invasive excision surgery. Excision meaning cutting out endometriosis. That's the proper technique to treat endometriosis as compared with the wrong kind of surgery known as ablation or fulguration or burning. Today, it means surgery. That particular surgery is the cornerstone of treatment, but I approach women from a head to toe perspective, mind, body, east meets west perspective, because endometriosis is an inflammatory disease. And it's such an unfortunate statistic or fact that most women go on average of about 10 years from when they initially develop symptoms until they're diagnosed. So if endometriosis is an inflammatory disorder, what it means is it sets in motion inflammation in the entire body. It becomes a systemic body-wide inflammation. So I target the entire body along with the right surgery to help women who are suffering from endometriosis to really reclaim their lives. So essentially, it's like the whole perspective plus the surgery in my perspective.
And I think that that is incredibly important because it's important for patients to understand how you have to treat multiple aspects of your body and not just removing the disease or, taking medication. You have to really come at it from a lot of different angles, and that's how you can see the greatest results. So it's important and amazing that you use this in your practice.
Mm-hmm. Mm-hmm. Absolutely.
Have you seen the patient's understanding and perception of endometriosis change throughout your career and more recently as there continues to be more awareness and knowledge about the disease?
Such a great question. I really do see an advancement in women's knowledge over the last roughly 2+ years. And I really owe that a lot to the Endo What documentary. It's such a wonderful documentary made by Shannon Cohn. You can download it at endowhat.com. And it has given women accurate information because it's so unfortunate. Physicians are not taught properly about endometriosis in medical school nor in residency. And most OBGYNs who complete a 4-year residency are taught the wrong symptoms of endometriosis. They're not taught a comprehensive approach. They're coming out of OBGYN residency doing the wrong surgery, burning the endometriosis. And that documentary, every woman who thinks they may have endometriosis or knows they have endometriosis or has a friend who has it should watch that documentary. So I think that was the beginning of laying a groundwork of proper and accurate information, and that has now made women rise up literally because their voices want to be heard. And I'm really sensing more than ever, a more unified approach by women who want to work together to really change the status quo. In my mind, I don't have endometriosis, but this is completely unacceptable to suffer for 10 years with symptoms, going from doctor to doctor, who's so baffled by endometriosis. Endometriosis, I think, is the easiest diagnosis to make if you ask the right questions. Are you having painful periods? Do you have pain throughout the month? Because yes, endometriosis can cause pain all month long. Teenagers can have endometriosis. In fact, 70% of teens with painful periods have endometriosis. Do you have intestinal symptoms like constipation or diarrhea or bloating or nausea? Those are huge symptoms of endometriosis. In fact, 90% of women with endometriosis present with intestinal symptoms. 52% of teenagers with endometriosis present with intestinal symptoms. Do you have any urological symptoms? Infertility, 50% of unexplained infertility, that means like the doctor doesn't understand why you can't get pregnant, is because of endometriosis. If you ask the right questions, it's such an easy diagnosis to make. However, OBGYNs, primary care physicians, pediatricians, family doctors are not being taught the right questions to ask. So I do see an evolution. I think there's more awareness. I think social media is helping. And I do believe, coming back to the initial question, the Endo What documentary, laying the groundwork and the foundation really has been at the core of a change in the status quo.
And what other specialists do you work with in treating endometriosis?
So, it's interesting. Most patients come in and want to schedule surgery tomorrow. But when they come to me, I assess for all different causes of pain, because we know most women with endometriosis have coexisting conditions, meaning they have other things that are also contributing to their pain. Pelvic floor physical therapists are usually the first stop, along with pelvic pain specialists or PMNR doctors, physical medicine rehab doctors. I also refer to urologists. I refer to nutritionists. I refer to pain psychologists. So to start with the pelvic floor physical therapy, the reason it's so essential is these young girls or women are suffering for 10 years before they're even diagnosed. And what does a young girl do or a young woman do when they have disabling, crippling pain with their periods? They assume the fetal position. They tighten their arms up, they shorten their abdomen, and they hunch over, they squeeze their whole pelvic floor. And thereby all of their abdominal muscles become tightened and their pelvic floor becomes tightened, because they have intestinal symptoms. So they're often straining on the toilet, squeezing to push out a bowel movement, or conversely, they have so much diarrhea, they're squeezing to hold in their stool. Many women urinate every 30 minutes, every hour and a half. So they're trying to push out urine, and again, they're squeezing their pelvic floor. So I would say most patients who come in to my office for an evaluation of endometriosis have pelvic floor tight muscles. So the first stop is to go to pelvic floor physical therapy. Again, finding a pelvic floor physical therapist who's trained in understanding endometriosis is as hard as finding an endometriosis specialist who performs excision. So you can't go to an orthopedic mill who does shoulders and rotator cuffs and knees and hips. You really need to find a pelvic floor physical therapist who specialize in it. And they are out there, and they're fantastic. Concomitantly, I'm usually referring to pelvic pain specialists who understand how the central nervous system works, who understand how endometriosis, this inflammatory disorder that's usually percolating for 10 years, for some patients 15 or 20 years, is flaring the central nervous system. So I have practices both in New York City and in Los Angeles. So I have a team of physical medicine rehab doctors, pain doctors. But it's important to understand these are not pain doctors who throw opioids at patients. Opioids are the worst medicine to give to a young woman or an older woman or a teenager who has pelvic pain. Instead, one needs medicines that calm the central nervous system. So it's important to find the right physical medicine rehab docs or the right pain docs who understand chronic inflammatory diseases. So the first stop, they go to physical therapy. They start to downregulate their central nervous system with the physical medicine rehab or pain doctors. I often will work on their nutrition. Anti-inflammatory eating is so important and so essential for these young women, because if endo is an inflammatory disorder, if you throw fast food at it, junk food, processed food, white food, box food, it's almost like feeding the inflammatory disorder. So it's really important for women to understand anti-inflammatory eating, eating organic foods. I also refer to pain psychologists, because if you think of 10 years, I don't know if any of you, I imagine most people watching have some kind of pain, whether it's endometriosis or another pain. Just for me, the thought of going to, on average, it's 8 doctors over 10 years who are baffled by this invisible disease. Most women who come into my office, they have lost trust in the medical community. They have some elements of anxiety, some elements of depression. I'd be depressed if I had something going on for 10 years and no one believed me, failed relationships, failed marriages, not succeeding and living your life to the fullest. So often for some women, working with a pain psychologist is so helpful for them to sort of just change the way they're thinking about the disease, and to be armed with tools when they do feel, anxious or depressed. It's not for all women, but that's very helpful. Along with that, referring women to do mindfulness. Some people do it in class settings. Other people do it through Headspace or the Calm app. Is extremely helpful. There's another subset of women who have urological symptoms, and I work very closely with urologists. Women who have painful bladder syndrome or interstitial cystitis can sometimes have bladder installations, which is very helpful. And painful bladder syndrome coexists in at least half of women with endometriosis. Some studies say up to 92% of them. So I'm always evaluating for that aspect, and working with a nutritionist. I mean, it's really endless. It really depends on how long a woman's been suffering, what else is going on in her life. But for that young woman who comes in and says, I want surgery tomorrow, I explain to them, I would be the worst doctor if I operated on you tomorrow. I love to operate. I feel so at home in the operating room. However, it's so important to identify all the reasons why a woman is in pain and treat each one of those coexisting conditions, and then do surgery. And I explain to women that, and I use a scenario and I feel like it's very tangible, that, imagine a little kid sees a hot stove. They're going to be inclined to put their hand on a hot stove, right? It looks enticing. It's red. They put their hand on the hot stove. Immediately their hand recoils. Why? Because the message goes up their arm to their spinal cord. It's interpreted by their brain, and the brain sends down a message to lift their hand off that hot stove. And I explain to women that if you're now, let's say, 29 years old and you've had pain since you were, let's say, 14, you've had pain at this point for, what is that, like 14 years. That's a hand on a hot stove, essentially going, ouch, ouch, ouch. Over those 14 years, you've been squeezing and clenching and tightening and straining on the toilet. Tight muscles becomes another hand on a hot stove going, ouch, ouch, ouch. Over that time, let's say you've developed urinary symptoms like urinary frequency, or developed painful bladder syndrome or interstitial cystitis. That too is another hand on a hot stove. All of these hands on a hot stove together start to flare the central nervous system, and that develops something called central sensitization. And that's precisely why I send my patients to pelvic PMNR doctors, physical medicine rehab doctors, and pain doctors to now calm the central nervous system down. So I do that for all of my patients. I literally try and lift up every hand off of a hot stove, get the central nervous system to calm down, and then I operate on my patients. And I have seen such success. My patients really reclaim their lives by that approach. And they really start to understand. And for some women, it could be 6 weeks. For some women, it could take 6 months. It really depends. And But what's important is to understand not all your symptoms are coming from endometriosis. Endometriosis is that first domino that caused all the other to fall, meaning it caused the tight muscles to happen. That's another domino. And interstitial cystitis or painful bladder syndrome. It causes central nervous system to flare, the central nervous or central sensitization. That's another domino. It caused the anxiety or depression. That's another domino. So I work backwards. I lift up all of those dominoes, and then I operate on my patients. So although they're coming in wanting surgery tomorrow, each one of them, when they come for their post-op visit, says, your approach worked. I completely understand what each pain generator, what type of pain was coming from each pain generator. And they were really able to separate out. It's like a Venn diagram. You have overlapping symptoms from endo, overlapping symptoms from tight muscles, overlapping symptoms from central sensitization and the such. And we basically tease out each one of those and then do surgery. And they do amazing.
And in terms of this network of specialists that you work with, are you in constant communication with them in regards to the patients and what their treatment is and what your treatment is?
Always. So, I mean, there are times where I speak with my, we call it our team, our inner family, more than I speak with even my spouse on a daily basis, because it takes a village. It takes a team to undo 10 or 20 years of pain. So I'm in constant contact. I tell my patients, I like to think of myself as a quarterback. Sort of coming back to the athlete that I was and am today. I'm like the quarterback, and it's so important to me to talk with my running back or the physical medicine rehab doc and all the rest of my team who's managing my patients. And it takes a village, but women with pain and endometriosis can get better. It's not going to happen overnight, but it will happen.
And what would you tell women who are struggling to find the proper care to treat endometriosis?
So that is the best question. So knowledge is power. You can't, I would say, I don't know of any general OBGYN, meaning a doctor who, and God bless a generalist, I could never be one, because the breadth of a generalist, they need to know, how do you deal with menopausal hot flashes? How do you deliver a vaginal baby? What do you do if a patient comes in with a sexually transmitted disease? What do you do with an abnormal pap smear? How do you do a whole host of things? So if their breadth of knowledge is so wide, it means their depth is very shallow, meaning they have very limited knowledge about endometriosis. And probably the facts that they're going to tell their patients about endometriosis are facts that are completely untrue today and were untrue 20 years ago. So I would say find a specialist in endometriosis. The way to find a specialist is either through the Pelvic Health Summit. I'm a big fan of Nancy's Nook. That's an online an online educational forum for women who think they have endometriosis or loved ones with of family members who have endometriosis or women themselves who have endometriosis. And there are certain Nook physicians, and you can search all across the world to find physicians, and really be your own advocate. Do not let your general OBGYN do your surgery. Because I call that, and I use the term that one of the doctors who trained me, Dr. Harry Rich, I was fortunate enough to be one of his last fellows before he retired. He called them a peakoscopy. And that's what a general OBGYN does, not a laparoscopy. Because a general OBGYN has no idea what they're looking for. Maybe they recognize one or two of the appearances of endometriosis, but they don't know that endo can be white or clear or red or blue or scarred or be in these peritoneal windows called Allen Masters windows. They don't know the appearances that teens and adolescents, which is one of my specialty niches. I love working with teens and adolescents. Their endo can be clear. So you don't want a generalist to put a laparoscope in. They're not even looking. You need to look from up in the domes of the diaphragm. You need to look at the liver, the gallbladder. You certainly need to look at the appendix, and then obviously the entire pelvis. Endo can be anywhere. You need to find a specialist. If a generalist looks in, A, they're not going to recognize the endometriosis, and B, they're going to burn the endometriosis. Burning endometriosis starts off multiple surgeries, because what happens is burning is only superficial. You imagine endo like an iceberg. So what you can see above the water is what a generalist can see. And they probably are recognizing only 10% of the endo anyways. And they start burning and cauterizing. And the endometriosis, which has been going on for 10 years or more, distorts the pelvic anatomy. It shifts the uterus and the cervix to the left or the right and tugs on the ovaries. And now you start burning. I think the analogy, I don't know if you've ever seen saran wrap by your stove by accident, you left it on your stove and it starts to shrivel up. The burning of the endometriosis implants further shrivels up the anatomy of the pelvis. And if everything shifted this way, it shifts it even more. And most women report worse pain after their ablation. And then one ablation surgery starts the downward spiral of a second and a third, causing more scarring and more pain. So do not let a generalist do your surgery. Find an excision specialist. When you meet your doctor, ask them what percentage of your practice is devoted to delivering babies. I think this is a great, really non-aggressive question to ask, because they don't know why you're asking the question. Because they're going to boast, 80% of my practice or 50%. Right there, they're not the right person to do your surgery. Do you want your doctor up all night delivering babies and then operating on you in the morning? No. And number two, they're not committed or devoted to endometriosis. So they're not going to recognize it and they're not going to know how to treat it. And then further ask the docs, do you do excision surgery? And if they say yes, ask them, what does that mean to you? Because a lot of doctors will do one excisional biopsy and call themselves an excisionist. However, they end up burn or ablating the rest of the endo. I see it in my practice day after day. I literally have to read the operative reports to my patients because they come in and say, I don't know why I'm in pain. I had excision surgery. And I literally read the operative report. An excisional biopsy was taken. The rest of the endometriosis was ablated. And, you need a doctor who's going to look at the big picture, the pain, the muscles, the bladder, and someone who's going to excise or cut out the endometriosis. So be your own advocate, do your research, and, the Pelvic Health Summit, Nancy's Nook, Endo Warriors is another great one. Those are all online sites to find good doctors.
That's amazing advice. Thank you for sharing that. Really helpful, useful, practical. And do you want to tell us about the new book that you wrote?
Yes, absolutely. So I just got this a couple of days ago from the publisher. This is a galley. So the actual book is coming out in June. I believe it's June 25th. And I wrote this and co-authored this book with a good friend and an amazing pelvic floor physical therapist, Amy Stein. And I've had this idea to write a book about endometriosis for a long time, because every woman who walks in my door, literally tears stream down their eyes, and they say to me, why didn't my gynecologist pick this up? Why didn't my gastroenterologist pick this up? Why didn't my internist know this? Why didn't my pediatrician? And it's so important. Just like that Endo What documentary that laid the foundation and accurate information, this book too is a multidisciplinary East meets West approach to really reclaiming your lives. And the title's Beating Endo, How to Reclaim Your Life from Endometriosis. And we incorporate specialists like our go-to physicians whom I refer patients to. It addresses how to be your own advocate, because I'm very hopeful and optimistic that in 5 years and 10 years, we're going to have centers that approach endo from the whole body perspective. But right now, this is going to arm patients with information. Oh, wow, I've got to find a pelvic floor physical therapist. I have to find a physical medicine rehab doctor or pain doc who understands endometriosis. I need to find that right bladder doctor. And they're going to hopefully walk into their doctor's office with this book and use this as their blueprint or their guideline to getting better. I want to add something in terms of that we didn't have a chance to discuss also is medicines for endometriosis, because no medicines cure endometriosis. Medicines just treat symptoms while endometriosis continues to progress. So one of the first line treatments, aside from like anti-inflammatory pills like Motrin or Advil, would be like the birth control pill. And it's a great first line treatment to help someone with bad period pain or heavy periods. So yes, it can treat symptoms, and for some it can be effective, but I want women to know that their endometriosis is continuing to progress. I see so many women who are put on, or teens, let's say, who are put on birth control somewhere around high school or when they get to college. Then they, go to grad school, they meet the right person and they're ready to settle down and have a baby. Let's say for some it's their 20s, some it's their 30s, some it's their early 40s. They come off the pill and they can't get pregnant. They blame it on the pill. It's not the pill. They had endometriosis for all of that time. Their symptoms may have been masked by the pill, but their endometriosis continued to progress. So I want to stress that no medicine cures endometriosis. If your doctor wants to throw a medicine at you, birth control pills are probably the best to help control symptoms, but your endo is progressing. There are other medicines out there, some that are newly released also, that have a whole host of side effects: bone loss, causing osteopenia, weight gain, memory loss, depression, suicide. Those are not the right choices because they may temporize some symptoms, but they come with a whole host of side effects and they cannot be used ad infinitum. So you come off those medicines, now you have a bunch of side effects and you're in the same place you were 6 months earlier or a year earlier. So I want to advocate, and this book really, it really says it like it is. It gives women the information. Before, women had to go on the internet, they had to search, they had to read. All that information is right here in this book. I've had this idea to do this book for a really long time. And honestly, I feel such pain for the women who walk in my office. And I finally said, and I met Amy Stein for coffee. And I remember that day and I said, Amy, I really want to write this book to help women with endo. 1 in 10 has endometriosis. It's close to 200 million women worldwide. I mean, it is crazy how long they suffer. And I said, pelvic floor PT is such a huge component. And let's educate the world about endometriosis to help women reclaim their lives. And finally, this book is born, and I'm so excited for women. I hope it's received as well as the hard work that Amy and I put into writing it. It talks about lifestyle, mindfulness, nutrition, pain, physical therapy, even the products that you use in your home, which are pro-inflammatory. So it's the one stop. It's like the encyclopedia for women with endometriosis.
Thank you for writing it, and congratulations.
Thanks. It's for our patients. That's why we did it.
It's going to be an amazing resource, and I know that so many women are really going to benefit from the information in it. So thank you again.
And I'm so appreciative to all the specialists, because every chapter we have specialists, part of our team, who we work together with to help our patients reclaim their lives. So I'm so appreciative to all of them. Each one whom Amy or I asked jumped at the chance to change the status quo for women with endo.
And for also everyone listening, where can they contact you, follow you on Instagram, or make an appointment with you if they think that they might have endometriosis and want to come see you?
Sure. So they can follow me on Instagram, Dr. Iris Orbuch, DRIRISORBUCH. My LA website is lagyndr.com. And my New York City website is nycrobotic.com. My LA phone number is 310-850-0051. And my New York phone number is 212-343-3040. But any of those sources, I'd love to meet you and help you. And really, there is hope. That's what I want to tell women. You can reclaim your life.
Thank you for being here and for sharing this information. It was really so fascinating, and I hope that everyone listening learns a lot and will start to heal from your knowledge and your work and this interview. So thank you again.
My pleasure. Thank you so much for inviting me on. I really appreciate it. Knowledge is power.
Thank you.
My pleasure.